To the organizers and participants of the 25th International Harm Reduction Conference in Montreal, bonjour. I'm Risa Hontiveros, a senator in the Philippines and a harm reduction advocate. There's an ongoing war against drugs in my country. Our president, Rodrigo Duterte, ran during the elections under a campaign platform against drugs and criminality. His slogan was, "Change is coming." He won. Change has come. It's been a year and 8,000 bodies hence. At the core of his campaign against drugs is his belief that drug users are not human. He was once quoted as saying, "Hitler massacred 3 million Jews." We all know that it was 6 million. Now there are 3 million drug addicts. I'd be happy to slaughter them. When you kill criminals, that is not a crime against humanity. Criminals have no humanity. Along with this is a whole gamut of drug policy reforms that aim to strengthen his crime and punishment approach. The reinstatement of the death penalty for drug offenses, the lowering of the minimum age of criminal responsibility, primarily to put in jail children who are young as 9 years old, who are used as peddlers by drug syndicates. The construction of compulsory drug rehabilitation facilities inside military camps. Mandatory drug testing in schools, workplaces, private and public institutions, wiretapping exemption for drug cases, and the proposed legislation allowing the police to issue subpoenas themselves to suspected drug offenders. It's only been a year. There's already an ICC case for mass murder and crimes against humanity filed against him and his allies. Groups such as Amnesty International, Human Rights Watch, Reuters have already documented his war. The EU has already issued a resolution against it, and 45 other nations called for an end to the killings. As a health advocate, it pains me that the Philippine government misses the complexity of the drug problem. The evidence is already available. Alternatives have already been proposed. There have been so many lives all over the world which were sacrificed for a policy model that is doomed to fail. The war on drugs in my country has resulted to a breakdown of law and order. A human rights crisis has already ensued. Yet, Duterte and his cohorts still fail to see that his war on drugs has become part of the problem. As a counter-narrative, I've filed the Public Health Intervention for Drug Use Act of 2017. It aims to institutionalize harm reduction as an alternative policy to our strictly punitive, Comprehensive Dangerous Drugs Act. It establishes a National Health Intervention for Drug Use Program, health interventions and strategies, community-based health intervention programs for people who use drugs, diversion programs, and voluntary treatment and rehabilitation. It exempts from criminal liability public health officers, barangay or village health workers, and other health personnel implementing harm reduction programs, persons who use or possess for personal use dangerous drugs, patients, caregivers, physicians, or medical researchers who deliver, transport, use, acquire, administer, cultivate, or manufacture dangerous drugs for medical purposes. Good Samaritans who assist a person involved with drugs who needs urgent medical attention. It prohibits apprehending, detaining, profiling, putting under surveillance persons who use drugs, mandatory drug testing, involuntary treatment and compulsory detention, traumatic physical and psychological intervention, non-disclosure of effects of medications and treatment, denial of health services by virtue of health or drug status, discrimination, and promotion of stigma against people who use drugs. This ambitious project aims to change the discourse around drug use in the Philippines, to start and stir the conversation towards drug use as a public health issue. And admittedly, there are a lot of things to do. Our government should be providing healthcare assistance to drug dependents rather than scaring them with imprisonment and death. We should be opening community-based outpatient harm reduction programs in friendly drop-in centers and outreach services. We should encourage the access to health services through improved peer education and support. We should be conducting harm reduction capacity building sessions for our local government units, health officers, and NGOs. We should spend resources on sustainable, evidence-based policies and interventions at the community level. With the popular support President Duterte and his war have, advocates like us should intensify mainstreaming the public health and human rights approaches. Indeed, our biggest challenge is to address the political capital and social control leaders gain from the stigma that comes with drug use. We should be convincing leaders like Duterte that drug users are humans too. They have the right to health, the right to life. Harm reduction is our offer to despots who play God. It's our weapon to end this war. It's our hope to save lives. Thank you. Merci beaucoup. Maraming salamat.